account, you spoke to the Minister of Health of South Africa. What was this all about? And the update on the China delegation of WHO as directed by the World Health Assembly to start the investigation. How far?
That's two questions.
With regard to South Africa, DG will speak to this, but the situation in South Africa, as you know, the numbers have been increasing, and the government are obviously looking at every possible measure to increase the intensity of the response there in support of their communities. And as part of that due diligence and reaching out for support and assistance and advice, the Minister of Health and his Director General, as well as other staff in the Ministry, have been reaching out to our regional office in Africa, to our Regional Director, Chidi Moeti, but also directly to the Director General. And our most recent conference call was a three-level conference call in which we were discussing the challenges that South Africa has faced, particularly the operational and technical challenges of scaling up the response at community level, scaling up surveillance, providing extra support to laboratory diagnostics, amongst other things. WHO is working with South Africa to provide surge capacity in very specific technical areas, and we're also providing virtual support, in fact a virtual mission as well to support that. So a number of key individuals at global and at regional level will be both providing physical on-site support to the response as well as virtual support in the coming days. South Africa has a tremendous internal capacity in public health. It has done a good job in responding to what has been an escalating situation, and it is only wise and smart that a responsible government will reach out for whatever assistance it feels that it needs to add to the quality and intensity of its response. And oh yeah, on the mission, yeah, well, yes, well, I'm not quite sure if they're there yet, but our small team is hopefully on its way to Beijing, or will be very, very soon. We've been engaged in a series of virtual consultations again with scientific and other colleagues at the National Health Commission, at the China CDC, in looking at work already done on the preliminary or earlier investigations and scientific studies on the origin of the virus. We continue to look at the opportunities for scientific collaboration and in terms of reference for an international mission, and we're already beginning to reach out to experts at the international level to see who will be available and most appropriate to be able to support an international mission in the coming weeks. Again, as I said previously, the logistics of that are not straightforward, I can assure you, but we are pleased that we now see the level of engagement that I think is important and will drive a successful mission. These are important questions. The answers are even more important, and I think everybody in the Chinese scientific community and the international scientific community is anxious to move forward with the appropriate studies to fully understand the animal origins of this virus. Yeah.
Thank you. Dr. Tedros, did you want to say anything more about